So, as you may know, the debate around health policy in the United States continues. There has been considerable backlash to the ACA, and we've seen that the Tax Cuts and Jobs Act of 2017 actually repealed the ACA's individual mandate. And this has potential consequences in terms of costs that may be increasing, but also has consequences as younger and healthy individuals will be less likely to purchase health care coverage when there's not an individual mandate. They won't have a fee, and so therefore those folks who are purchasing health care are going to be older and potentially individuals with more healthcare needs, and that also contributes to higher costs and greater risk in the insurance pools. Another thing to keep in mind is that there's still discussions on the other side about, ways that we can further move towards universal health care and particularly single-payer healthcare models in the United States. So in 2017, Senator Bernie Sanders proposed a Medicare for All bill, which would essentially take the model that we talked about with Medicare, where everyone pays in and then is able to access health insurance and distribute that across the entire society, not just individuals age 65 and over. At this time, it doesn't seem that this particular proposal is gaining traction, but there are definitely discussions going on both sides about what the best next steps are in terms of addressing healthcare needs in our country. Now I want to take a minute to move away from that central debate around access to health insurance that we've been talking about and just touch on a couple of federal health policies that have specifically targeted underserved and underrepresented populations. So I want to note the existence of federally qualified health centers. Many individuals that will be serving may be accessing care through federally qualified health centers. These centers began as neighborhood health centers, and they were created via the Economic Opportunity Act of 1964. So again, part of President Johnson's Great Society and War on Poverty legislation to ensure that individuals that had many barriers to care or did not have access to primary care services were able to have local centers to address that need. In a similar vein, we saw the creation of rural health clinics in the 1970s. Again, similar access challenges in the rural areas necessitated the creation of specific clinics in these more remote locations to facilitate individuals' ability to obtain necessary primary care services. We also need to be aware of the Indian Health Service, and these are health services that are provided on tribal land to American Indian populations. And again, the focus on improving access and mitigating treatment access disparities for underserved, underrepresented groups.